I've been talking about Body RX because I think there was a void to be filled in the South End, and I think we finally done it. Medically supervised weight loss, going to make you look younger as well. All kinds of really procedures for those of us who'd like to appear a little bit younger, and I think that includes a lot of us. With me now is Dr. Suresh Nair. He's back on the show. Dr. Nair, welcome back.
Well, thank you.
You know, we had a lot of folks who are really interested in your place, had a lot of questions. If you have a question today about Body RX, give us a call, 571-5263. In fact, everyone who calls with a question for Dr. Nair will be in the running for a free $50 gift certificate courtesy of Body RX. Okay, let's talk about all the services that you offer. First of all, I mentioned weight loss, and I know it's important to you and your wife and your staff. Medically supervised weight loss, correct?
That is correct. Physician supervised. We do everything based upon the principles of internal medicine. We have our practice, our internal medicine practice, right next door. So it's simply part of that holistic approach to dealing with health, wellness, feeling good, looking good, and like you said, you know, fall's here. October, November, December. These are the 3 months where traditionally we pack it on and we carry it on to the next part of the next year. And so we have found that if we concentrate on these 3 months to teach people the principles that they need to learn and bring this to a part of town that really needs it, it's all worked out really well. Yeah,
you know, it's all about convenience, and the new location on Dixie Highway, and we'll throw that up on the screen real quickly. I think it was definitely needed. There's the address, 8594 Dixie Highway. Dr. Nair and his wife, Sarita Nair, she's a doctor as well, a doctors of internal medicine, which tells me you're really overqualified. I mean, that's one of the toughest degrees to get in the field of medicine. With that being said, we've talked about this a little bit before, but what inspired you and your wife to start this practice? I'm curious.
Well, I think we certainly felt that, you know, a lot of the diseases that we run into as far as diabetes, hypertension, cardiovascular disease are all related to the fact that, well, inactivity, obesity lends a tremendous amount of impact towards those diseases. If you can impact obesity, activity, lifestyle, well, then you affect the diseases and you decrease their medications and you improve their lives and their longevity.
You know, no one would really know that better than someone who practices internal medicine, because like you said, you're seeing all the diseases. You're saying if I can reduce your weight, it's the positive snowball effect that we talked about.
Right. Right.
I mean, we're talking about you lose a little weight, maybe your blood pressure goes down, maybe your cholesterol level goes down, and then pretty soon you're looking better and feeling better.
Right. John, we see it day in and day out. Greatest feeling in the world to get them off a lot of these medications. It really is. And we have found that over a period of time, it's not just cost savings, it's not just longevity. They're saving as far as you know, their insurance coverages. They're influencing their family members, their friends, and that, you know, the best form of advertising is really word of mouth. And you know, another individual telling you know, their family members or their friends about our practice and how we approach weight management, aesthetics, and internal medicine. That's really helped.
Okay, remember, Body RX of Louisville. And before we talk about their services, we do have a phone call for you. Wanda has a question for you, Dr. Nair. Wanda, good afternoon and welcome to the show.
Yes, good afternoon. I was wondering, I'm a diabetic, and I was wondering if it would be healthy for me to lose weight, or would it be harmful?
Wanda, the majority of diabetics in this country are diabetics only because of weight, almost 93 to 95%. And it's only because the adipose tissue causes their insulin not to be effective. They're making plenty of insulin. So yes, you're absolutely right. Once they drop the weight, what happens? Their insulin works better, and they suddenly stop becoming diabetics at a certain point. And it becomes activity, lifestyle, and diet managed diabetes. And so, yes, you would definitely benefit.
All righty. Thank you very much for the phone call. If you have a question, 571-5263. You're going to meet Dr. Nair's better half, Sarita. Dr. Sarita Nair is coming on the show as well. We'll talk about the services they offer, and I actually might get some of these wrinkles taken care of. We're going to talk about that coming up next. Welcome back, Body RX. We have moved sets. We had an addition of a couple of young ladies. We have asked Dr. Nair to remain on with us, and his wife, Dr. Sarita Nair, is with us as well. Doctors of internal medicine who decided, hey, let's help people lose some weight. Let's be proactive here, help them look younger, feel more energetic, and that's what we're talking about now. If you have a question, 571-5263, and you will automatically qualify for a $50 gift card at Body RX. Dr. Nair, welcome.
Thank you.
You know, I didn't have a chance to talk to your husband, but we're going to talk about services coming up here.
All right.
Before I do that, though, I want to introduce everyone else here on set. Tracy, welcome to the show. Tracy Knight is with us. She is an esthetician, correct?
Correct, yeah.
And Natalie Graham. Natalie, what do you do exactly at Body RX?
I do a little bit of everything. I handle the wellness program there at the spa. I guess you could say spa coordinator, but
Okay.
just help out where needed.
That's right. You're a woman of many talents. That's a good thing. That's a good thing. Dr. Nair, I want to ask you and your wife, first of all, you make a beautiful couple, don't they? I want to put them like on the cover of a magazine or something. You do. Let's talk about your services. Okay.
She'll go through the esthetician services. What we have in weight management is basically a program, medications. We have an ultra-burn injection that's very helpful as far as metabolism and helping you to lose weight. We have a program that you can actually use for a lifetime, and that's really the most important thing. Getting you there, that's pretty easy. Staying there, that's really the most important thing. So weight management wise, we really apply internal medicine principles to it. We follow you over a period of time. We get you to your goal, and I'll let them explain the aesthetic side of it.
All right, we have a couple of specials, but the aesthetic side, I know we mentioned the Botox treatments. What other services do you offer, doctor?
Well, we do Botox and filler. Those are injectables done by me. And then we have our esthetician. She does laser treatment and makeup and facial. We have massage therapist who's not here with us today, but we have those services. And Natalie is the one who helps me with all the procedures.
Okay, let's talk about some specials. We're going to throw up some specials up on the screen for WAVE3 Listens viewers. If you would, tell us about this. You got a Botox special going on and a medical weight loss special as well.
Yes, we have Botox $8 per unit, and that's for this month. And we also have a very special, this Saturday only, we are going to do Juvederm or one of the fillers, and you get 10 units free with that. And Xeomin, which is another neurotoxin we use for wrinkles, and that's going to be 20 units, and you get $50 gift card, and that's only this Saturday.
All right, that's good stuff there. We've got some more specials there listed on your screen. We have another question. Tammy is with us, and I think she has a question about Botox. Tammy, good afternoon. Welcome to the show.
Are you having a good day?
I am. How about you?
Yeah, so far it's been great. But I was wanting to know about the Botox. How long does that look last, and how often do you have to get it redone?
Botox usually is 3 to 4 months. But Tammy, if you keep your treatments, like if you keep it up every 3 to 4 months, with time you're going to need less units and it's going to last longer.
Okay, good question though.
Very good question.
So from what I understand, what you're really doing is the nerves will quit reacting, so the longer that you do it, the longer it takes for them to come back and bring those wrinkles and make them more prominent again. So like you said, if you do it every 3 months and you're pretty consistent, pretty soon maybe it's once every 6 months?
Exactly, and how it works is we inject Botox in a very specific muscle, and we relax those muscles, and it will last you 3 months, like you said, 3 to 4 months, and now you're training your muscles to be relaxed, and with time it's going to need less units and it's going to last longer because you have trained your muscle to relax. You're not going to frown when you're angry at your kids.
All right.
They'll love it.
Barbara is with us now, and she has a question for the doctors. Barbara, welcome to the show.
Well, thank you.
You have a question?
Yes, I do. I have wrinkles around my lips, around my chin, and I was just wondering if that Botox could help me out.
Yes, it does. Wrinkles around your lips, it can be from some people smoke, so smoking can cause that. We can do Botox with that, and also fillers work really good. There's a new filler, it's not very new, but it's newer. It's called Bellatero, and we can use that very superficially to fill those wrinkles. So Botox, yes, it works, but filler does better.
Okay, thank you very much. Good information here. Brenda is with us now. Brenda, welcome to the show.
Hello.
Hello, Brenda. You have a question for the doctors?
Yes, I do. They didn't mention anything about acupuncture, but I've been checking into it, and I wanted to see if that was something they may foresee in the future. And I've been hearing that it could possibly help tie in with Botox. I wanted their response to that.
Well, acupuncture is an alternative treatment. We certainly have referred patients over for smoking cessation, for pain management situations where other treatments haven't worked. It does go after substance P, does release endorphins when applied properly and by a certified acupuncturist. As far as it relating to Botox, really the two are almost unrelated as far as its effectiveness. Botox is certainly much more effective in terms of relaxation of muscle, and if you're talking about migraine headaches, you know, Sarita certainly injects Botox for that situation as well. But different principle, different chemicals involved, so the two really are unrelated that way. Are we looking at it for the future? Absolutely. Alternative therapy is certainly to be looked at.
All right. Thank you very much for the call. Body RX, Dixie Highway. You want to look younger, feel better, medically supervised weight loss? Give them a call today. I encourage you to do so, especially if it's in your area. There's a real need there. I think on Dixie Highway, you guys have, I love your location. Thank you very much. A lot of good folks there, and you're going to love the services they offer at Body RX. Okay, Dr. Nair, I'm going to put you to work. She has unfortunately had to look at my face, and she said, you know, I could put some silly putty here, or I could do this. You're going to have to bring in the truck for a lot of Botox. But there's the information on the screen. So what do you recommend? I said, what do you think you would do, Doc? So I want you to take a look at me and tell the folks what would you do here?
What I would do is I'm going to see how you use your muscle, because everyone expresses themselves differently. And then depending on that, I'll be injecting Botox. Today, that's what I brought, Botox. And we are going to inject that and smoothen those wrinkles.
So I'm going to go home today and my wife's not going to recognize me because I'm going to look so young, right?
Yes, and she'll think that you didn't work today because you look so relaxed.
Oh, I like the sound of that. Okay, well, make me feel like I didn't work, because I'm looking forward to this. Here we go. All right, I'm going to put you to work.
All right, so what I'm going to do is just clean up a little bit so that we have...
You had to look at me. Where do you see problem spots when you were looking at me before the show?
Yeah, what we did is, if you can frown for me. Now, if you see, I mean, you can see, but when you're frowning, these muscles are very active, and that's why you get this 11. So I'm going to inject one here, and then I'm going to go to this muscle, and I'm going to inject 2 injections here. Now, if you raise your eyebrows, this is a frontalis muscle, and that's what causes the wrinkles across your forehead. So I'm going to do 4 injections here.
So it's really important that you know the musculature of the face.
Definitely.
And being a doctor, you do. So, okay, we got still a couple of minutes left, so I'm going to let you have at it here.
Okay. It won't take very long.
Okay.
And I promise.
Once again, Body RX of Louisville, located on Dixie Highway. Here we go. Got a little television makeup. You're going to find a mess there.
All right, so let's do this. Okay, John, I'm going to ask you to frown. Frown, yeah. Now relax. Okay, now you're going to feel like a mosquito bite. Here we go.
It's not bad.
All right.
Not bad at all.
All right.
While you're injecting me here, I think we have a call. Susan is with us.
Okay.
Susan, we'll probably I hope we're going to let your husband handle this, because I'm a little nervous now. Dr. Nair, hand your call. Susan, welcome to the show.
Hi.
Frown.
Hi, Susan.
Hi, how are y'all?
All right.
My question was about, I think, the fillers. You mentioned the filler in the upper lip from smokers. And I was just wondering how affordable it is. Is it not too expensive? And do you have to do both lips at the same time?
Okay, the pricing on the fillers for the lips, 600?
600. It's we usually use one syringe. Is I think that should be enough, and that's $600 per syringe. But we have special. There's a 10% off for the month of October, and if you are thinking of even doing Botox, we can do on Saturday, where you get 10 units free Botox with syringe of filler.
There's the specials up on your
That's the
screen
special,
there.
yeah.
If you're unsure, the great thing with Dr. Nair's practice, they always do free consultations, so you'll know what the treatment's going to involve at that time, price, what you'll be up against, so you can really have an educated decision before you decide to do anything.
Okay, we may not have time to take another call, but we're going to give it a shot. Is it Lynn we have on the line? Lynn, welcome to the show. Hi, Lynn.
Hello.
Hello. Go ahead, Lynn.
Yes, my question is considering the insurance with the weight loss management systems. Do most insurances cover that?
No, the insurances do not cover most of the medications or the service. We try to price it as affordably as possible. There are package deals that we have. We do separate them as well, and as compared to most places in town, we feel that we are more than competitive, we don't keep the medications on site. They're certainly much better at a pharmacy where quality control is certainly, well, to us, is certainly a premium. So unfortunately, insurances do not cover it.
All right. We're going to go over our specials once again before we go to break. Tracy, if you'd help us out, we'll throw the specials up on the screen. If you could tell everybody to come on out to Body RX.
Yes, come and see us at Body RX. We're on Dixie Highway. We do have the $8 unit Botox, and then we're going to do the 10% off all fillers. So, and then also we're doing for laser treatments, the hair removal, $199 for a small area, and that would include lip, chin, or underarms, and then facials as well. We're having a special for $50.
All righty, thank you so much. Body RX.